Healthcare workers have always filled an important role in the community, especially during the pandemic.
But more and more of them are now working outside of their communities. New tonight, our Abby Larico takes a look at the impact traveling nurses and other medical professionals have on our local hospitals.
Of course, she got the car to go places.
That was like a bucket list item for me.
But it's going places that got Kimmie Sorden the car for herself and another for her dad.
I've done things that I never could do as a staff nurse.
The ICU nurse left her full-time position at a St. Louis hospital to become a travel nurse 3 years ago, currently in Peoria, Illinois.
From a financial perspective, yeah, that was the biggest thing for me.
Sorden remembers her traveling colleagues getting better pay, shifts, and assignments for the same experience.
It becomes frustrating at times.
Traveling healthcare workers typically sign contracts of at least 13 weeks to work at a hospital where they need extra help, and they're paid a premium to do it. The job site ZipRecruiter lists the average pay of nurses in the St. Louis area at $28 an hour. But make that travel nurses, pay goes up to $46 an hour. Agencies like True Staff connect the hospitals with the workers they need.
So we're there to step in and kind of help fill those holes. And then once they're kind of settled and they get their own staff up and running and oriented, we can then move that nurse to another location to help that facility.
Are travelers the problem causing a staffing shortage, or are they the solution trying to work around this?
I think we're the solution.
For me personally, I do enjoy that area of working where you're needed.
Chris Davies is a traveling respiratory therapist who's worked contracts with 3 different St. Louis hospitals. As hospitals around the country have needed to staff up during the pandemic, he's seeing a spike in demand.
Right now, I'm seeing almost every single hospital in the state that needs somebody. 3-4 years ago, you might have only had 3 hospitals, not hospital systems, but hospitals that had traveling needs.
As a patient, does it cost me more that hospitals are relying on traveling caretakers like this?
Absolutely not. It is not passed down to the patient. Your hospital is going to budget for these incidences.
And they've had to budget more. True Staff alone is sending 5 times the number of travel healthcare workers they did before 2020. They expect that to level off along with the pandemic.
We just have to kind of take it month by month, week by week, really. It will not stay this high forever.
Sorden hopes to see the trend shift in reverse. More healthcare workers staying put.
I wish the hospitals would do more to retain the staff that they have.
Moving forward, she and thousands of other nurses will find their opportunities on the road.
Right now, it's a no-brainer.
Abby Larico, 5 on your side.
We reached out to the local major hospital systems to find out how many travel medical providers they employ. St. Luke's says less than 0.5% of their team members are temporary, and the other systems did not provide a response.